That's obviously the purpose of meetings like this, is to get people together from different walks of life, different perspectives, different disciplines, so that we can come together to figure out how it is we can learn from one another, teach one another, potentially partner with one another for the purpose of, at the end of the day, providing better care to people who need it the most.
We know what we can do, and also we can only really make meaningful, durable, sustainable shifts if we're working in partnership across the public and private sector, the philanthropic sector, the not-for-profit sector, kind of big enterprises, startups. I mean, we need kind of the whole ecosystem, of which I know so many people here are part of, to really not only make, but then secure and continue to advance progress on any area that we care about.
At Medtronic, we've come up with what we call an AI compass, but this is something that we've got to collaborate with others in the medical technology industry, the provider side, payers, of course the regulators. The FDA is very involved in this, and just governments in general.
We've made protein therapeutics and antibodies for a long time. There's a lot of data we have, and you have to do a lot of predictive steps as a scientist to say, okay, which one of these will turn out to have more drug-like properties? The computer's really good at that.
We have to find a model that is incentivized, and if we don't, you will see continued, I think, and we will use the word disruption or reimagining. Consumers will demand more. Why? Because we can. Why? Because we know there are new opportunities. Why? Because generations are going to change how we think about how health is actually delivered globally.
We can transact business digitally. Absolutely no question about it. We can do a lot. But the one thing we can't develop and create digitally is trust.
So many people don't have access to the kind of care I was lucky enough to get. So how do you see this changing the equation for the terrible inequities, unconscionable inequities that exist in our healthcare system today?
How do we bring communities up to speed, marginalized communities up to speed, so that when it's all time for us to embrace what AI means across the board, system-wide, across the board, you name it, that we are not serving the population that gets it while leaving the marginalized community that hasn't had the access behind?
I would like to issue a call to action that we return next year, reinvigorated and with new ideas and thoughts of collaborating to really think about what is the strategy going to be going forward. Wherever we think of these sweeping changes in healthcare that is our burden and our opportunity now, there's a real person involved.
It was an awesome experience to see that, and the way they explained it to me and what was going to happen and what they were looking to do was very innovating.
This period of discovery is going to be extraordinarily important for all of us. Remember, it's not just only about the success of our own individual businesses. All of this is about the eventual success of providing best care to people out in the community and improving health overall.